show. Now, if you're looking for a solution to wrinkles, perhaps you have some stretch marks or uneven skin tone you're not happy about, this Dermaroller facial could be the thing that you're looking for. And the great thing is you don't have to use it just on your face. So here to tell us a little bit more is Dr. Patrick from the Aylesbury Clinic. Laura Birmingham. We'll be chatting to you in a second. Laura, first of all, Patrick, tell us what exactly is the Dermaroller facial?
Okay, well, I suppose before we actually talk about the Dermaroller, we should look at the skin itself. Okay. Everything above the blue line is a protective layer of skin. Everything below it is the dermis. The dermis is the workhorse of the skin. This is where the fibroblasts are. This is where collagen is. This is where elastin is. As we get older, the fibroblasts, to an extent, forget to sort of make collagen. If a young child falls off a bike and sort of, cuts their hand, it repairs itself.
Heals very quickly, yeah.
We know that if you cut the top of a child's finger and they're 3 or 4, it'll grow back on. If you have an old lady in a nursing home in Bray, it mightn't heal for weeks. Okay. So we know that if we perforate the outer layer of skin, injure this in some way, then new skin grows. And this is wonderful because these little rollers come with different sizes of blades in them, different sizes of needles. So as a consequence, this can treat anything at this level all the way down. So the upper level, people can use it themselves at home. It'll take away maybe things like pigment, open pores. Once we start breaching this blue line and we get down into the epidermis, we can, if we go down deep enough, even draw blood. It'll work on everything from acne scarring right through to wrinkles, as we've seen earlier.
So it's an alternative to Botox, potentially. Everyone's gone Botox mad in the world. Certainly all the celebs have it.
So Botox, we see it to an extent, is relaxing muscle and taking away wrinkles. This is actually allowing the body to repair itself.
Okay, so it's a more natural way, in a sense.
Absolutely. And this, to an extent, almost can do something like the fractionalized resurfacing lasers we're doing earlier. Now, we know this for a long time. Believe it or not, we knew that if we brought people into a tattoo studio, took away the ink and just used the little needles in their face, suddenly their skin got better. Right. We knew also, for instance, that mesotherapy, even if you put water into it rather than all the vitamins, the skin get better. I myself in Australia back in the 1990s was using equivalent of this in acne scarring. Right. Dr Fernandes in Cape Town came up with a little, sort of punch. So the theory behind it has been around quite a long time.
Quite a while. And we have a lovely model here, Sylvia, this morning. Now, her face is shiny because you've obviously put some sort of an anaesthetic on her. Yes. Which makes me think that's going to be a bit sore. It
can be slightly painful, and certainly depending on the problems we have, we could have 2 different sizes of rollers. This is unique. This is one that we have sort of made specially. You wouldn't see any of them in the UK or Ireland to a large extent. There's a 3mm.
Now you can see they're quite large there.
Absolutely, but that would be certainly unique.
What would you need that for, kind of?
We use that for deep acne scarring, absolutely. So this 1.5 millimeter blade will get to an extent down into the dermis. Okay. And if we were rolling it to any sort of large extent, we could draw blood. Now, I don't, for the sake of the audience, want to go too deep. But most people would turn red and
so
remain
the
red
after
for a few
effects
hours.
are red, redness around the face, a little bit sore and tender, I presume.
Absolutely. But then we have a second thing which really is even better, which opens up. Because we have holes all the way down now into the sort of through the epidermis into the dermis, then we can add in some products. This is a wonderful thing here. This is from the Image range, and it contains Japanese green tea, which we know as an antioxidant is 20 times more powerful than vitamin E. We also have got the hyaluronic acids within this, in this sodium hyaluronic form. And we also have, I suppose, a situation where we can add in some of the creams that have actually vitamin C in them. Now, vitamin C is present in a lot of cosmeceuticals and it doesn't work.
So you're saying when the skin is tender, the pores are open, to be able to put these product in, it'll really reach down to the dermis.
Absolutely, Laura. And it's not even the pores are open. We've made these little channels down into the skin. And believe it or not, it's because the dermis, to an extent, is hydrophilic. It'll almost like draw the sort of serum back down into it.
Listen, I'm all for making myself look about 19 again, but I don't know if I can handle the pain. Let me bring in Laura here. We're doing this today because you've had a huge interest in getting rid of blemishes, some scarring from our viewers.
Well, we consistently get texts into the show about acne scarring, and there's a lot of mums out there who are in the stages maybe with their teenagers that they're actually only going for treatment now about acne. But then in the aftermath of that, if they don't, they might get to control it or whatever, but then they don't really know what to do next, and they're kind of looking for products, or they're looking for a So this, to me, because Patrick has been doing this for so long, I kind of think as a treatment for guys and girls, for maybe younger people or older people who, you know, are not sure, really, do they want to go down the kind of clinic route where they think it's all lights and gadgets and machines and stuff, you know. So this, to me, makes completely perfect sense.
In some sense.
Well, yes, but, you know, it can be done on the body, and it can, you know, it can be done to treat some amazing things, but it's a completely natural reaction.
And in fact, we do have some photos, which we must have a look before and after versions. I think we're going to have a look at someone's cheek before the roller derma facial. We can have a look at the cheek there. Now that's, I suppose that's kind of deep set wrinkles really, isn't it?
Yes, I suppose in the older age group, one of the things that unfortunately happens is that as we get older, our ability to form collagen compared to the ratio of it breaking down changes. So if we can do anything that sort of, you know, can restore collagen,
look at the after one,
the sort of the younger you do it, obviously the better. Now we found this many years ago when we were using things like isologen. People in the 20s and 30s often got the best results. So if you're in a situation, I suppose, where you have an older person, they're better probably doing it at 60 than 70 and they're going to get better results.
So essentially what we're saying is this is a treatment if you want to banish those wrinkles you don't like, if you're trying to defy gravity and I suppose defy the ageing process, but also if you have a problem that has nothing to do with vanity, if you're talking about acne scarring, perhaps some lumps and bumps after having a baby. I mean, those things you get in your belly, stretch marks are horrendous. Would this work for stretch marks?
This will work for stretch marks as well, absolutely. You could see this thing as almost like a task masker. So what it's doing is going into the skin and saying, okay, all you guys wake up, start repairing everything here. And then depending on the level we want to get to or the problem we want to try and solve or address, then we can use different sizes of it. So it's a wonderful little thing that, you know, the treatments themselves aren't particularly expensive. Normally treatment was about between 250 to 300.
So I was going to ask you. So
so I think, you know, there's...
For how many? 3?
There's different deals going at the moment where you can actually get, you know, sort of 3 for something like 200.
Yes.
But you need to be very careful. Most of the sort of beauty salons can do maybe 1 millimeter, maybe 1.5.
Cosmetic surgeon to do this, though?
You would need a doctor to, when you get down to the dermis, where you can technically cause scarring. So some of the bigger blades, like this one here, then certainly it'd be the medical clinics that would be doing those.
Right, okay. Thank you so much,
You're very, very welcome.
Patrick. Thank you very much, Sylvia. I hope that you're not in pain, are you?
Not at all.
Okay, well, that's good. It's a great advertisement. Now, listen, Laura, you're going to be a busy lady today. You're going to be back with your online Friday beauty clinic. So if you do have a question for Laura, either about the Dermaroller facial or about anything else that you'd like to ask her beauty-wise, all you have to do is text AM followed by your query to 53131. And Laura's going to be back with all of your answers online from midday onwards. So thank you very much, Laura. Thank you, Patrick. Thanks, Sylvia. Get ahead to the news now with Siobhan.
Thanks, Laura. And